Eastern Equine Encephalitis, and there have been 9 deaths across 7 states, and it's come to Pennsylvania too. In a moment, we'll talk to an infectious disease expert about it. But first, for more background, let's turn to this report from NBC's Ann Thompson.
Sophia Garabedian should be in kindergarten, but the 5-year-old is in rehab after more than 2 weeks in the hospital for Eastern Equine Encephalitis, speech and pet therapy helping her to regain the ability to talk and eat. Her family says the Massachusetts child is making steady progress. Triple E, carried by mosquitoes, is afflicting the nation's old and young, with new deaths reported in Massachusetts and Connecticut of 2 older individuals.
We have never seen this much activity at this high a level over such a wide geographic region.
Across the country, there are now 9 Triple E deaths out of 28 cases in 7 states. Triple E can cause headaches, high fever, and in severe cases, inflammation of the brain, leading to seizures and paralysis. Spray trucks out early in the morning at East Hampton, Connecticut schools to try and stop the spread.
It's definitely a concern. The first frost is sounding good.
The best way to kill this deadly scourge of summer. Ann Thompson, NBC News, New York.
And here to talk about it is Dr. Amish Adalja. He's an infectious disease expert. Welcome back, sir. How are you?
Good. Thanks for having me.
All right. Eastern Equine Encephalitis. Geographically, horses encephalitis. How does it get the name Triple E?
Well, it gets the name Triple E because encephalitis, that's just a fancy word that means inflammation of the brain or infection of the brain, so that's where that E comes from. It usually is something that's geographically around the Great Lakes, around the swampy states in the eastern part of the United States, and then equine because it can infect horses, and it was actually isolated in the 1930s from horses, and there is a vaccine for horses for it, so that's where that moniker comes from.
But we understand mosquitoes spread it now to animals as well as humans?
Right, so mosquitoes are what allows this to get into humans and what allows it to transmit between, actually its natural host is birds, so it's always in this kind of cycle with songbirds and mosquitoes that live around swamps. But sometimes other mosquitoes can pick it up and then go and bite humans, they can bite horses, they can bite dogs. There was actually some wolf pups that died in Michigan at a zoo that were bit, so that's how it spreads into the human population through these bridging vectors, which are these certain mosquitoes that like to bite humans.
Well, what's the best way to protect yourself?
There is no vaccine for it, so the big thing that you have to do is be vigilant about mosquitoes. So that means wearing the appropriate clothing, wearing mosquito repellents, draining areas of your yard and in your community that might be breeding sites for mosquitoes, that's standing water. That's really all you can do until we develop a vaccine.
Does this mean we should be afraid to go out into the great outdoors until fall really gets here and kills off the mosquitoes?
No, it's really important to remember that though we're seeing headlines talking about this and we do have a record year, it is a pretty rare infection, and people shouldn't really change their daily habits or panic about this. They should just be vigilant about mosquitoes. And West Nile virus is something that's even more common that will probably infect more people and kill more people every year, but this is the one that's grabbing headlines now, and that's the one that's getting people scared. But West Nile is probably our biggest mosquito threat that we have in the United States.
What sort of mosquito repellent should you use that's effective?
There are mosquito repellents that have a chemical in them called DEET, D-E-E-T. That is the best way to repel these mosquitoes. There's lots of natural things, but really I stick with the ones that have DEET in them.
And that's the best way. What about wearing light clothing if you're out for a walk or a bike ride in the evening or afternoon?
I wouldn't say light clothing, but making sure that the clothing covers your wrists, your arms, your legs, which can sometimes be difficult when it's hot outside, but that type of covering so that there's less exposed areas of your skin, that's really key to preventing mosquito bites.
You know, you mentioned DEET. I wonder about this stuff. When I was in Vietnam, just like that truck used to go through, a Jeep would come through wherever we were in a fire base, but the fog was much thicker than that, and we used to laugh and say the mosquitoes were snorting it because they were so big. I wonder how effective those kinds of spraying programs that we saw in that Ann Thompson report are.
So it depends on the type of mosquito. Sometimes spraying works, but with a lot of the mosquitoes that bite humans, the spraying doesn't really get to them because they live around your house. They live in your backyard, near your swing set, near the tires that you might have put in your backyard, in the plants, the pots that are in the debris. So the spraying may not get to those areas. So that's why spraying has to be part of a comprehensive mosquito control strategy, which will include cleaning up and getting rid of standing water.
So DEET is really a repellent. It doesn't kill the mosquitoes?
It actually is toxic to the mosquitoes, and it repels them from coming near your skin. And that's something different than what they're spraying. They're spraying different types of pesticides when they're spraying in the community versus what you put on your skin.
So the best thing to do, should we worry about this, or is much of it media-driven, as you say, getting the headlines now?
There definitely is a signal there. We're in a record year. These numbers haven't been seen since the 1960s. We're seeing this in more states. It is concerning, but it is still not a very common infection. It's not something that people have to worry about. And like I said, it's nowhere near the burden that West Nile is in the United States.
We saw that little girl who so tragically looked like she was heavily affected by this illness. What are the first signs, and is early detection something that can help in terms of not having the brain be inflamed as much?
So the thing that makes Eastern Equine Encephalitis so scary is that it has such a high mortality rate, and those people who survive are left with disabilities. So the first symptoms are like
flu.
So
it's lasting.
Yeah, so fevers, chills, headache, you might get that, and then a percentage of those people will progress to brain infection, where they may get seizures, coma, paralysis. And early detection doesn't really make any difference because there's not any antiviral that you can give these patients. They're either going to get it or they're not going to get it. We don't quite understand what allows Eastern Equine Encephalitis to be so severe in some people. Some people get it and have no symptoms at all. But it is important, if you do have those symptoms, to be seen by a physician, because maybe you need to be put in ICU. There are other supportive care that may help with some of the complications. But that progressed, and if you're getting brain infection, there is no specific treatment for it.
No specific treatment?
No.
That's worrisome. All right, we're going to take a break. When we come back, we're going to talk about HIV and a new treatment for that. I hope you'll stay tuned.
I just love dogs.
That's why this local 7-year-old is on a mission to help police canines across the country. With her sweet tea stand and T-shirt sales, she's raised thousands of dollars for canine units.
I think she's doing for local departments and for us is just remarkable.
Helping our heroes makes us proud to be from Pittsburgh.
Proud to be from Pittsburgh. Brought to you by your local Honda dealers. Great cars, great people. For a great deal on a Honda, visit shophonda.com.
Attention farm workers and groundskeepers. The weed killer Roundup contains glyphosate, a chemical now classified as a probable carcinogen by the World Health Organization. Workers exposed to Roundup on the job may be at a higher risk for non-Hodgkin's lymphoma. If you or someone you know was exposed to Roundup and diagnosed with non-Hodgkin's lymphoma, you may be entitled to compensation.
Call Sokolov Law now at 1-800-249-3872 for a free legal consultation. That's 1-800-249-3872. I'm a non-attorney spokesperson.
If you or a loved one has mesothelioma or any other asbestos-related cancer, call now. Asbestos manufacturers sold deadly asbestos materials to thousands of companies, putting workers at risk. An estimated $30 billion in court-ordered trusts have been set aside to pay out claims to asbestos victims. You may be entitled to a portion of these funds and receive compensation without filing a lawsuit or ever going to court.
For your free legal consultation, call 1-800-568-5308. That's 1-800-568-5308. I'm a non-attorney spokesperson.
Are you drowning in debt? Struggling just to make minimum payments? It's not your fault. Serious debt can happen to anyone, but there is hope. Our debt-free program has helped thousands of good people, just like you, eliminate their credit card debt. Call us today, and we will dramatically reduce your credit card debt down to just a fraction of what you owe. The call is free. The consultation is free. Take control of your credit debt. Take control of your life again. Call now to see how our debt-free program can work for you.
Call 800-853-8931.
Dr. Amish Adalja is here with us. He's a board-certified infectious disease physician. He is also the senior scholar at the Johns Hopkins Center for Health Security. We're hearing now about this new kill switch that's supposed to turn off the virus that makes HIV go into full-blown AIDS. What do you think of the research that's being done on that?
Well, there's been great advances in HIV over the last decade or so, and one of the holy grails is trying to understand how to reach some of this virus that our current antiviral medications don't reach. So we can treat HIV, get the virus undetectable in the blood, make it untransmittable, but there's this reservoir of virus that's basically stuck in the genetic material of our cell that if you come off therapy, it roars back. What this new research is trying to get at is understanding how to allow those cells to become visible to the immune system, to drugs, so that we can actually go after this long-lived reservoir and then effectively cure HIV and have people not have to be on treatment forever. So this is an early study that's going to take a lot of follow-up, but it is important to emphasize that it is really promising, and it's lots of different avenues going after this reservoir of HIV that we've not been able to reach.
When we talk about genetic treatment of these diseases, is it going to be effective, or will it raise some other concerns because we're changing genes within the human genome?
So when you talk about gene therapy for HIV, what people are really trying to do is go into the cells that have HIV, integrated into our DNA. HIV is very tricky. It integrates into the DNA of the human. And going in there with molecular scissors and cutting that out, cutting those HIV genes out. And there has been some effort to do that with promising, interesting results. And the danger is that you want to make sure that it's only cutting out what you want it to cut out and not having any off-target effects. So that's going to be a challenge. But so far, at least in the early studies, we've seen that that's feasible, and it needs to be scaled up so you do more of it.
How do you think that we have improved with the treatment of HIV since the 1980s, when it seemed like contracting it was a definite death sentence?
It's completely a different disease. So before 1987, there were no antiretrovirals for HIV. Now, in 2019, you can't even count how many there are. There are so many that we have, so many options. And HIV is no longer a death sentence. People who contract HIV now live normal lives. They have children. If they're on medication and their virus becomes undetectable, they cannot transmit it to anybody. We have prevention strategies, something called PrEP, a pill that you can take that prevents you from getting HIV. So we've really changed HIV from a death sentence to something that is very manageable, something that is actually easier probably to treat in many ways than diabetes.
So much so that I see it, or treatment for it, advertised now in direct pharmacy to treatment of patients. Is that a good idea?
I do think it is, because we do have about 15% of people in the United States that are unaware of their HIV status. They are contagious, they're not on medicine, so we want to get as many people diagnosed, treated, and placed on medications and virally suppressed as we can in order to stop this outbreak. It actually could be eradicated if we could scale it up high enough right now.
And is there a danger if you don't treat this of not getting treated, that it comes back again, you said?
Yeah, if you stop your medications, this virus will roar right back. So you have to be on treatment for life.
Dr. Adalja, thank you very much for your time.
Yeah, thanks for having me.
All right, we'll take this break and come back with one more thought in just a second.